Okay, final talk now. Okay, so we've got Richard Smith next, who is the Senior Software Developer from Healx. So Richard's going to be talking about RareOmics, which was mentioned earlier. This is a new free online tool to track rare disease research.
Thank you very much. So, David's talked about Healx this morning, so we use a lot of data analysis to try and reposition drugs for rare diseases. And we've just made a free tool available on our website called RareOmics to help you track the scientific literature around the particular rare diseases you're interested in. So there are over 1 million biomedical journal articles published every year, which works out about 1 every 30 seconds. Over 100,000 of those mention a rare or orphan disease. So the number of papers varies dramatically depending on the disease. So the rare cancers may see thousands of papers per year. Some rare diseases, very few. So for example, Alström syndrome, just 27 papers in 2015. And the idea of RareOmics is to help you find the papers on the diseases you're interested in amongst this million papers that are being published each year. And we do that by text mining, which Jane has just explained very well. So we run text mining on all the abstracts of all the articles that are added to PubMed every day. The advantage to identify diseases, genes and other terms that are mentioned. And the advantage to that is because everything in biology has many different names, we can automatically search for all these different name variants to make sure we find all the mentions, or many of the mentions. The screenshot of the RareOmics homepage, so currently includes over 1,000 rare diseases, which we will expand. So if you search for something and don't find it, then please let us know. And here I've just done a search for ataxia, got back several results. So the software understands hierarchies in diseases. So if I were to click on the page for ataxia as a high-level term, I'd automatically see results for the specific subtypes of ataxia. So an individual disease page, so the main part of the page, so this one's for Rett syndrome. The main part of the page on the right-hand side is a news feed, where you can see all the latest papers, with the newest ones at the top. And the idea is it's very fast to scan down and see what papers are about. So you can open up the abstracts and read them in line. You can also search all of the papers on Rett syndrome with that search bar at the top. On the left-hand side, you can see the most frequently occurring terms in Rett syndrome papers. So you can see the genes, the other diseases, the drugs, and so on that occur most often. So you may find interesting things in that list. And you also click on all of those things to filter the feeds, so to find all the Rett papers that mention a particular gene, for example. And if this were a disease I were interested in, I could click on the follow button to add it to my own personalised news feed to stay updated on new Rett syndrome papers. I could also choose to receive an email once a week if I want to, with a digest of the new papers that are being published. So as I said, you can click on the abstracts to open those up and read them in line. And there we highlight all the terms we've identified, and you can click on them to see a definition, to understand some of the biological jargon. Each disease also has a stats page. So at the moment we've got some quite simple charts. So this one, for example, is showing the number of papers published per year on Duchenne muscular dystrophy, which seems to be increasing nicely, which is good. And some other charts to identify the top authors and the most mentioned genes around the disease. And this is an area we'd like to add a lot more features around, so identifying trends and other stats around particular diseases. In general, this is a very new tool that we've only just released, so we'd love you to try it out and give us any feedback on how we can make it more useful for the rare disease community. So in particular, we're interested in adding other sources of data, so clinical trials, for example, helping patient groups find relevant researchers, and also promoting funding calls and conferences to those researchers. And something we're really interested in doing is helping you discover insights from related diseases. So you may be tracking all of the information on the disease that you're particularly interested in. We'd like to work out ways where you can find important trends or new discoveries in related rare diseases. So we'd be very happy if you could try it out and let us know what you think and give us any feedback. Thank you very much.